your station. All right, so if you've read and understood, considering its surgical pathology station, please tell me what is the provisional diagnosis you will consider for this patient?
My provisional diagnosis will be giant cell arteritis.
Okay. Right. What exactly is joint cell arthritis? Kindly define.
It is a granulomatous inflammation of the large to medium vessels of the head.
Yes. Which are,
and
yes.
which are mostly the branches of the ECA and
No
superficial
abbreviation in exams. Okay. So ECA stands for
external carotid
external
artery.
carotid artery. All right, please. Okay. What complications can arise because of this condition?
Patient can go blind because of this, or patient can have thrombosis of the vessel, which can lead to blindness.
Okay.
And patient can have headache in this and lockjaw
Okay.
pain during mastication,
Mm.
and
And
also have headache while combing.
yes, and there could be claudication, which can cause tongue claudication, jaw claudication, scalp severity increases on the scalp. All right. Before it, one loses the vision, could be visual loss of visual acuity, diplopia, acute tinnitus, and etc. All right. Please tell me what is the mechanism behind joint cell arthritis?
First of all, the uh, intima layer of the vessel gets thickened, and the classic pathogenesis is actually the medial granulomatous inflammation of the internal elastic lamina, causing the internal elastic fragmentation, and there are also infiltrates of macrophages and CD4 or CD8 cells, and there are also giant cell accumulation uh, around the media.
Macrophages, which accumulates around the granulomatous infiltrate. Okay, please tell me, what investigations would you ask for to confirm your diagnosis?
In the biochemistry, we can do the ESR, and
Yes.
the classic diagnostic investigation is actually the biopsy of the long segment of the vessel.
How would you comment? Are the biopsy always conclusive
No, it's
or
not always.
diagnosis?
It's not
50,
always conclusive.
50%. Okay, which part of the vessel is affected most commonly?
It's the media layer, tunica
Tunica
media.
media. Yes. All right. You have told me about the, okay, tell me you told me the pathological changes which takes place in tunica media.
Yes, same medial
Yes.
granulomatous
Yeah.
inflammation,
All right. Okay.
macrophages.
Please tell
Yeah.
me, how many, yes, okay, which blood test is conclusive or is required in this condition?
ESR.
Okay. Right. What should be the treatment that can be offered to this lady?
We can give corticosteroids like prednisolone, 60 mg per day for 2 years, or if the patient has decreased visual acuity or amaurosis fugax, then we can give the IV methylprednisolone.
Okay. While giving corticosteroids to the patient, what complications or outcomes you should keep in your mind?
Corticosteroids can cause osteoporosis and which can lead to pathological fractures of neck or femur or any vertebral fractures.
Okay, especially in postmenopausal female like her, 87 years old.
Yes, it is more common in postmenopausal women.
Okay, please tell me what is the mechanism by which corticosteroid causes osteoporosis?
There are three mechanisms. One is the decreased bone peak mass, and another is resorption of the bone, and third is actually the inadequate formation of the new bone during turnover.
And the complication you said could lead to pathological fractures. What other causes could there be which can cause pathological fractures?
If there are skeletal metastases or Paget's disease or multiple myeloma,
Yes,
uh, they can all cause pathological fractures.
right. Okay, all right, if a biopsy has been done, what expectations or histological lab do you expect to see, which is conclusive of joint cell arthritis?
Uh, there would be on microscopic findings, we would see the medial granulomatous inflammation of the media along with the presence of the giant cells around.
Okay. Right, you've already told me, right, okay. Why exactly patient has visual disturbances?
Because sometimes the ophthalmic artery is involved in this, as the retinal artery is the end artery or branch of the ophthalmic artery, it can cause blindness or decreased visual acuity.
Considering this scenario, please mention all the risk factors or all the causes that can lead to osteoporosis.
Uh, Osteoporosis has primary and secondary causes.
Yes.
In primary causes, it could be idiopathic or postmenopausal or senile, and in secondary causes, there are endocrinological causes like diabetes mellitus, hyperthyroidism, and there are also metabolic causes like malabsorption or vitamin D deficiency, calcium deficiency, or in miscellaneous causes like there are multiple myeloma, the malignancies and neoplasias, which
Okay. This lady you were managing with corticosteroid had neck of femur fracture, right? And you decided to go through total hip replacement for her. On her post-operative day 1, she suddenly appears to be with shortness of breath and petahi over her total hip replacement where you've done the procedure. What diagnosis would you suspect or what complications would you be conscious about?
the fat embolism because
Good.
uh, for the neck of femur fracture, the orthopedic surgery that is nailing, intramedullary nailing, it
Yes.
can cause the fat embolism.
Yes. So, all right, you've told me the mechanism. How should you go about to manage that now?
Uh, the management of fat embolism is mostly conservative. We need to give oxygen or ventilation to the patient. We need to maintain the electrolytes and fluid balance, and we can also need to
Generally prevent patients from sepsis and take care of the nutrition. All
yes.
right. Right. Whenever, like when you're managing her, what would you consider or keep in your mind? She's taking
Uh,
steroids, so
so I would consider to Addisonian crisis to
yes, in keep in mind, yes.
Yes, and for that pre-op, I will give more steroid and convert the typical other steroids to hydrocortisone.
Right, very good. Okay, bell has gone. I've almost asked you all the questions. Good, thank you.